My name is Ricardo Juárez Mirto. I'm going to present my work entitled Ablation of the major pelvic ganglion differentially affect prostate lobes in rats. This work was carried out at the Autonomous University of Tlaxcala under the direction of the Dr. Yolanda Cruz Gomez. The prostate is an accessory sex gland that contributes to the seminal fluid. A rat's prostate consists of the three distinctive parallel lobes: ventral, lateral, dorsal. This function is under endocrine and neural control. Prostate innervation is provided by the major pelvic ganglia, a parallel structure that contains afferent input from the hypogastric and pelvic nerves, as well as its lateral and contralateral commissural nerves that give these ganglia interrelate. Commissural nerves could lead to contralateral reinnervation after unilateral nerve injury. The aim of this study was to determine the effect of the unilateral MPGA in rats on the morphometric characteristics of the ventral, lateral, and dorsal lobes of the prostate, the short and long term. The experimental protocol was approved by the University Committee on Laboratory Animals. According to the guidelines of the Mexican Council on Laboratory Animals Care and NIH Guide for the Care and Use of Laboratory Animals. We used 9 adult Western male rats assigned to 3 groups: sham surgery 2 weeks after MPGA and 20 weeks after MPGA. After MPGA, antibiotic and analgesics were administered. After 2 or 20 weeks, the prostate lobes will collect and process for Mason trichrome stains. The alveolar density and height of the epithelial cells of the right and left lobe on the prostate were measured. Paid student tests between left and right sides and ANOVA between groups were used to analyze the data. We found that the ventral lobes on the prostate are the largest lobe. Most of their area are in close anatomical relation to the urinary bladder, the dorsal lobe, and dorsal to the seminal ducts. Its lower region covers the dorsal wall of the rostral urethra. The lateral lobes are in direct relation to the rostral portion of the urethra. The posterolateral region of each lobe is covered by the MPG. There were no significant morphological or histological difference between the left and right prostate lobe in sham animals. MPGA2 and APGA20 significantly decrease the alveolar density and the height of the prostate epithelium in the treated lobe. The area of the alveoli significantly increased in the ventral lobe ipsilateral to the ablation in the both group MPGA2 and APGA20. Our finding indicates that MPGA affects the ventral prostate lobe more so than the lateral and dorsal, ipsilateral to the ablation, which indicates that the ventral lobe is fully innervated by MPG. The fact that the lateral and dorsal lobe are partially affected suggests that this lobe might have another source of innervation, such as the accessory ganglia or contralateral innervation via MPG commissural nerve. No significant recovery was observed at long term, which indicates that MPGA links to the prostate permanent dysfunction. It is concluded that MPGA differentially affects the lobe of the prostate, which event more effect on the ventral lobe. However, this lobe is closer to the bladder than the urethra anatomically speaking. This information should be considered in preclinical studies of autonomic nerves and prostate cancer in rat models, where ventral prostate lobe is analyzed.